Well done for getting here today, because I was at the gala dinner last night. I was thinking there's no way this lot are going to get up in the morning. So thank you very much for coming along. Hello, my name is Rozs, and I'm absolutely fascinated by the power of connections, and in particular the power of active citizenship and digital technology, and how those two things together can build connections and improve lives. And I'm also really believe that patients and citizens are the most undervalued resource in health and care. And that goes for the development of digital technology too. And I think that the paternalistic relationship between citizens and patients and healthcare is changing. And for that reason, I thought I would flip the idea of prescriptions today from one where an expert authorises my medical treatment to one which I'm going to use to really prescribe how the principles, I guess, of how we can work with patients and citizens as partners, as leaders, and as experts. So I want to use real examples, and I hope to convince you that when health and care digital technology is at its best, patients are not the problem, they're part of co-creating the solution. I'm going to talk to you about my own experience of living with diabetes and how I use technology, and you'll notice I'm wearing a sensor here. But I'm also going to talk to you about the other part of my life, which is working for a social enterprise called Recovery Enterprises and a digital wellbeing hub that we have developed. So I think an important place to start, if we're talking about co-creation, is understanding or building shared understanding and shared purpose. And our shared interest today is about connecting care, homes, and communities. And what we need to, and using digital technology to do that. But what we need to understand, and I was really pleased to see this in the white paper, that digital and technology is an enabler. It's not the end, it's the means to the end. And I guess the end, really, ultimately, is the improvement of health and well-being. So what does good health and well-being look like? So a little while ago, about 2 years ago, I picked this up on Twitter via a GP in Australia. And it's the Aboriginal definition of health and well-being, which I really like. And it says that it's not just the physical well-being of an individual, but also the social, emotional, and cultural well-being of the whole community in which an individual is able to achieve their full potential as a human being, and thereby bringing about the total well-being of their community. So what I really like about this is that it's recognising the intrinsic link between the well-being of an individual and their community. So it's saying that being connected matters. And also it's looking at the whole person, so the social determinants of health, which I hope you're all sort of fairly, or at least a little bit familiar with. So it's recognising the importance of things like shelter, warmth, food, sense of self-worth, social networking, etc. And there's many sort of theories, evidence-based theories that you can look at, which really sort of provide you with the evidence for why we should look at the whole person's health. So Maslow's hierarchy of needs, salutogenesis, the Flourish theory, 5 ways to well-being just being some of those. So a little bit about me. I'm a mother of 2 children. I live in Sheffield. I've got an MBA. I love the outdoors. I love photography. And I'm the managing director of 2 enterprises. And I'm also the non-exec director of Patient Opinion, which is an international social enterprise that you may have heard of. And all 3 of those are interested in people-driven digital and using that to improve lives. And I'm also one of 400,000 people in this country who have type 1 diabetes. And some people say that this is one of the most complex conditions to self-manage. So digital technology is really useful. The reason I'm explaining all of that is not to show off, it's to highlight that each person comes in their own context, each patient comes with their own context and their own life beyond their condition. They are more than a set of conditions. And that also that they bring a unique set of talents and resources and ideas and insights. And I think that's really important today for 2 reasons. One, to remember that one size will never fit all. And secondly, to think about how patients bring with them that set of resources and how could we unleash that to improve health and well-being. So digital technology has made a huge difference to me in my ability to self-manage my complex condition. I spend about 5 to 10 minutes with a specialist diabetes consultant a year, And sometimes I get a bit of extra help from the specialist diabetes nurse. And that's probably about it for self-management and my connection with the formal health and care system at the moment. I inject insulin about 5 times a day whenever I'm sort of eating. And I test my blood sugar level about 5 to 10 times a day, depending on what I'm doing. So if I do exercise or drive a car or do a big event like this, I'm usually testing a little bit more. And what I'm looking for, I'm trying to see where am I at right now? Am I having a hypo or hyper? And trying to keep my blood sugar level within the normal sort of boundaries. And the reason for doing that is to reduce the potential for complications later on in life. And this has become a lot easier since getting this piece of technology here that's in the picture up there and I'm wearing today. And this is called Freestyle Libre. And in the old days, I would just test my blood sugar level by pricking my finger and squeezing a bit of blood onto a strip. And what that would do is tell me where I'm at right now with my blood sugar level. What this does is not only is it easier, so I just swipe it like that really quickly, and I think there's an Android app as well that you can use on your phone. But it helps me to understand where I've been, what's happened in the last few hours with my blood sugar level, where I am right now, and where I'm heading to. So it gives you a sort of directional arrow. So I know I can see if I'm heading towards a hypo, and I can cut off and prevent hypos, which is really important. And also, so it's made a huge difference to me in terms of spotting patterns and responding to what's happening in my body. And I can connect this with my laptop and upload it onto DiaSend, and then my healthcare professionals can see that data as well. And together we can co-create my better self-management. I also use a sort of whole variety of apps, and I was interested to hear Orca talking yesterday about the 2,500 diabetes-related apps that there are. Can you imagine what it's like being a patient sort of trying to choose one of those? Most of them, I think, or most of the ones I've looked at are really not very useful at all. They're usually sort of single sort of item focused. They're not very engaging. They're really difficult and non-intuitive to use. And I don't believe that most of them are co-creative with the people that they're for. But I do use some. I use one in particular, Carbon Cows. That's really helpful because every time I eat, I have to look at the food I'm eating and try and calculate the sort of carbohydrate sort of level in them, and then I have to match that with insulin. So, and not every piece of food, like last night, it comes in a neatly wrapped up sort of label with the exact amount of carbohydrates. So I have to sort of work that out, and Carbon Cows helps me to do that. And I also, obviously, I use Fitbit. I don't think it's doing its job on me. I don't know how many other people have really found it useful, but it does help me to sort of encourage me and motivate me to sort of do a bit more exercise, do my 10,000 steps. And also, what I found, which I didn't realise, was that it would help me to manage my sleep patterns and be a bit more effective in my sleep patterns. But all of these are great. They're all great tools in my kit. I'm really sort of pleased that they're around. But what affects my use of them is my mental and social and emotional well-being. And actually, digital has helped me with that too. So it helps me to connect with my support network, my family, my friends, my peers. And it helps me to find information at the touch of a button or the swipe of a screen whenever I want it and need it. So, for example, I found myself in London late at night. I'd caught the late train into London, and I left my insulin and my whole kit on the train. And I sort of had an absolute panic and thought, oh my God, what do I do? What do I do? And then what I did was I went on Twitter and asked some of my peers on Twitter, what do you do if you've left your insulin in Sheffield? And I was able to find out what to do next. But it also kind of helps with those social determinants of health, as it does all of us. So whether it be sort of looking for a job or finding a home or any kind of information, and that's a really important part of my digital technology. I also use social media and tools like Patient Opinion to feed back my ideas and insights and experiences back into the system. And I think it's really important to, and I find it really important to help to contribute to improving the experience of care for others. And it helps me to feel valued and purposeful and useful and like I've got some sense of control. And I've also used it to help me make decisions. So about 11 or 12 years ago, I was really sort of struggling with the choice of whether or not to have children, and it's really complicated for somebody living with type 1 diabetes. And I went to the consultant and I got all the sort of proper sort of evidence-based advice, and I went to the NICE guidance and looked at that too. And it really wasn't enough for me. So I searched everywhere and I found a blog of somebody who it felt was like me and had gone through the process. And what it did, my experience is never going to be the same as that person's, but what it did was help me to work through the issues and make the right choices for me. And I don't think that anything can replace that authentic and empathetic understanding that peers are able to bring. So access to data and information, the ability to make choices, and sense of control over my own destiny, and being an active member of my community has made a really big difference and is fundamental to my self-management. So talking of my community, there's been a whole raft of really amazing patient leaders that have come out of the type 1 community, and they've done all sorts of brilliant things. And so, for example, Night Scout, I don't know if you've ever heard of the "We Are Not Waiting" hashtag, but it's really worth having a look at. People with type 1 diabetes come, and other patients come with all sorts of ideas and talents and resources. So we've developed Night Scout, T1 resources, Our Diabetes, My Sugar, Momo Active, Input Diabetes are just some of the digital technologies that have come through. And I think what's really important to acknowledge here is that people with lived experience have skin in the game, and they have a unique expertise and a deep level understanding of their needs and wants. And also they're motivated, often motivated to change lives, to change their own lives and others, and improve lives. So beyond diabetes, this applies beyond diabetes. I think probably one of the best examples ever is Molly Watts, who you all saw yesterday, who is a real advocate and patient leader, and goodness knows what she's going to do next. But there are some other sort of examples like IOSTM, IBD Relief, and BDP Chat. And there is actually a whole platform designed to push patient-driven innovation called Patient Innovation. And there's a sort of movement forming called PD Digital 16 is the hashtag. So it's worth having a look at that as well. So I've been also very privileged to be involved in co-creating Shefford Flourish, which is a digital wellbeing hub designed to support people living with mental health conditions to find the connections and the resources that they need to live the lives that they want to lead. And what we've done here is it's been co-created with patients. So what we're trying to do is change the way our city thinks about mental health and create a more mental health friendly city, and recognise that people with lived experience, patients, are partners, are leaders, are experts. And we've taken a blended offline and online approach because we think that that's a really important thing to do with digital. We've recognised the issues around inclusion, and I think that if you don't tackle digital inclusion at the same time as pushing digital technology products, you may be compounding inequality. What we've tried to do is build something that's aspirational and hopeful but realistic, and recognising the challenges of living with mental health conditions. And we work in partnership. We think that partnership's one of our most important sort of principles. And what we're trying to do is unleash the assets that we've already got in our city and in our people. So engagement of people beyond the usual suspects, reaching deep into communities is really important for us. So we started with the key question that I think all people involved in health and care should start with, and maybe it's a life question as well. What matters to you? Not what's the matter with you. We translated that and we asked, what do you need to live well? And funnily enough, people didn't talk about medication or self-trackers or telecare or electronic health records. Actually, what they talked about was, it's really important for me to feel a sense of purpose, feel like I'm part of something. So whether that be part of a group or employment or volunteering, to feel purposeful. They also talked about the need to feel valued and have their voice heard. So that goes back to the kind of getting involved in improving the experience of care. And they talked about social networking and peer support. That was a really big sort of area. And the biggest area was about dreaming and making. So they talked about anything from walking their dog to listening to others' inspiring stories. And what we discovered along the line as well was that there was all this stuff out there, but people didn't know about it. So and that was both online and offline. So whether that's, I don't know, Tinder Foundation's Learn My Way, digital inclusion site, or the Healy Community Computer course, or Couch to 5K on NHS Choices, or the Oasis Gardening Project, or even TED Talks or the Burn Grieve Film Festival. People didn't know about all these things that were at their fingertips. So about 180 people were involved in co-creating Shefford Flourish before we launched it in July. And since then, we've had about 1,700 users. Our target for next August was 1,300, so we're quite pleased with that. And we have about 40 volunteers involved in shaping, building, creating the content. And also, we've trained and supported digital ambassadors, so people from the community to go out into their communities, into GP surgeries or wards or waiting rooms, community venues, to help other people to learn about Shefford Flourish and related digital resources and help them to go online. So in terms of the impact, well, it's early days, but we're already getting healthcare professionals referring into the site. In fact, we've got one occupational therapist who wants to work with us to design specific training for engaging her colleagues in the Care Trust. And they're starting to sort of really get excited about this. And local community organisations are starting to feed back to us and let us know that they've had new participants that have come via Shefford Flourish. And we had one ship-shaped shower the other day who complained on Twitter that they'd run out of crumpets because we sort of lots of our people had come to their activities. And our members are starting to talk to us about how this is helping them with those things that I talked about around sense of purpose, being able to feed back, getting involved, feeling part of a community. And that thing about feeling part of a community is the key. That's the thing that really seems to be making the difference. And we've even had some compliments as far away as Adelaide, who said they had a look at our site and they've talked about they're going to set up Adelaide Flourishing Communities. So we're quite pleased about that. So I guess the learning for us is that if you work in partnership with patients and citizens, you're unleashing a whole set of resources and knowledge and ideas and insights that you didn't have before. And the resources go up exponentially if you do that. Secondly, that if you co-create with people, that you design something that they really need and want, and you get closer to that. And then thirdly, that, and I think this is quite important, we were talking about this last night at dinner, that around engagement, if you co-create with people, they become your marketeers. They go out and they sell your product or your idea. And that really is, I think, quite key in terms of spreading the word and diffusion of innovation. And really, I think Rob Webster was talking yesterday about the power of community, and I think that really comes through for us. So just summarising really, I guess, all that I've been sort of trying to share with you today, I think that co-creation has a positive impact on health and wellbeing on so many levels. And there is a whole evidence base behind co-production and community building and all of that. I tweeted out a link under the hashtag earlier, so if you want to see that has a whole kind of list of different resources around the evidence that there is, if you want to check that out. So here's my prescription, just kind of summarising what I've been talking about. First of all, start by building shared purpose and always start with the question, what matters to you? Secondly, always understand the holistic and community context in which people live. And remember that patients are more than their conditions, and they can also be partners and leaders and experts. Build choice, information and self-efficacy into your designs, and understand that co-creation is essential, it's not desirable. So finally, I think that if we're going to develop all these fantastic 21st century digital technologies to help us, let's also use 21st century approaches. I think that paternalism is history, and co-creation and patient-driven digital is the future. Thank you.